this. Now, the Council of Governors is accusing the Ministry of Health of failing to disburse funds to be used to pay doctors as agreed in the return to work formula. In a statement, the Council of Governors is blaming the ministry for the failure to sign the collective bargaining agreement, which was supposed to be signed by Friday last week. But it is emerging that confusion in the Council of Governors as to the signatories to the doctors' negotiated CBA and recognition agreements was the reason why the deadline was not met last week. Let's now cross over to our City Center studios where our medical correspondent, Dr. Masi Korir, is ready to shed more light on this. Dr. Masi, good afternoon. With the time lapsed, what next now for both the doctors and the Council of Governors?
Thank you, Akisa. I think the good news is that the doctors and both parties, that is the ministry and the Council of Governors, signed a consent to extend the deadline by 14 days for the Council of Governors and 18 days for the Ministry of Health, in which time all the parties hope to have signed the recognition agreements and the collective bargaining agreements. And as you had said, there was some confusion in the Council of Governors as to who would sign the two documents, that's the CBA and the recognition agreement. On one hand, the county public service boards, that is the chair and the secretary of these boards, were saying that they are the ones that are supposed to sign or to commit the counties into any agreement with the doctors because they are the employing authorities. On the other hand, the Council of Governors said they got a legal advice that one, the CEC, that is the county executive member, committee member for health, the chief officer for health, and the county secretaries are the ones who are supposed to sign these documents. That is the line department in like a mirror from the Ministry of Health. And so that was what was the bone of contention. But within these 14 days, the parties will come into agreement as to who will sign, either all the parties, that is from the county public service boards to the line department and the doctors' union. But within 14 days for the Council of Governors and 18 days for the Ministry of Health, the doctors have said they expect that these documents would have been signed because they've seen goodwill from both parties. Akisa.
Even with the goodwill, what really has been the problem? Because even after the strike, it looked like everything was clear on the signing of the CBA and everything else. What might have gone wrong between then and now?
Well, they have cited that the law has been silent on who is supposed to sign on the side of the county governments. For the national government, it's straightforward that it's the line ministry, that is the Ministry of Health, the PS, who's supposed to sign. But on this other hand, the county governments, the law is not so clear as to who is supposed to sign. So the parties had an amicable agreement to extend the deadline from Friday by 14 days in order to arrive at an amicable solution to sign the documents. But we're expecting that within this deadline, the documents will be signed and there'll be no industrial dispute between the doctors and the employing authorities from the national government and the county governments. And one other thing that you'd mentioned was on the disbursement of payments to the county governments, where the statement by the Council of Governors said that they had not received any money from the Ministry of Health. But prior to going on air right now, we received a statement from the Ministry of Health where they notified the Council of Governors of the payments, including the breakdown, the 1.49 billion shillings to the counties to pay 3,962 doctors and 1.7 billion to pay just over 24,000 nurses, and it's a breakdown to all the counties. So we expect that this impasse between the Ministry of Health and the county government will be solved because according to the Ministry of Health, this money was paid by 12th of May, which was last Friday. So we expect that whatever impasse had been there between the Ministry of Health and the county government will now be laid to rest. Akisa.
Thank you for that update, Dr. Masi. That's our medical correspondent, Dr. Masi Korir, joining us from our City Center studios. Now, moving on.